Good morning, respected professors and colleagues. I'm Hong from Shanghai, China. Thanks for the invitation from the conference. It's my great honor to share our research, although unable to attend the on-site meeting. Next, on behalf of our team, I will present our research, development of nursing quality indicators for high-flow humidified oxygen therapy in respiratory medicine wards. This study is finished by the respiratory care team for Shanghai 6 People's Hospital. Before diving into our research, I will first briefly introduce our hospital and the respiratory department. Our hospital has a long history tracing back to 1904, with over a century of medical heritage. Now, we own two branches, Xuhui branch and Lingang branch, where we are now. 3 regional medical centers, Anhui, Fujian, and Haikou Hospital. We have 3 academicians, Chen Zhongwei, Xiang Kunshan, Jia Weiping. 3 birthplaces, including Chinese ultrasonic dialysis, the cradle of worldwide limb reconstruction surgery, the birthplace of the China hand. Next is our pulmonary and critical care medicine department. We have 2 campuses for respiratory care, including the following areas: the ward, bronchoscopy room, lung function room, LAMP, the lung regeneration medical dialysis and treatment center. The respiratory intervention dialysis and treatment center offers a number of techniques, including lung lavage, balloon dilation, hot steam lung reduction surgery. Then I'd like to introduce our professional nursing team. Our team members covers all age groups and professional seniority levels. We have respiratory specialist nurse, rehabilitation specialist nurse, qualified nurses for critical care, international wound care specialist, which guarantees the implementation of our quality indicator research. Next, I will introduce our research from 4 sections. Part 1, objective. High flow is a respiratory support modality that delivers heated and humidified high-flow mixed gas through a long-sealed nasal cannula. Respiratory failure remains a predominant and critical condition in respiratory medicine wards, with high-flow therapy serving as an essential intervention. Many patients with severe respiratory illness transition from ICU to respiratory ward, where they continue to receive high-flow therapy as part of sequential respiratory support. Compared with traditional oxygen supply, high flow improves patient comfort, reduces the intubation rate, maintains stable positive and expiratory pressure. It has been widely applied in our respiratory wards. This picture shows that I'm performing a high-flow operation demonstration during the COVID-19 period. Nursing-sensitive quality indicators serve as metrics for evaluating nursing service processes and outcomes, including structure, process, and outcome indicators. For clinical nursing management, NCs are the core management tool. Scientific, standardized quality indicators can continuously promote standardized nursing behaviors and improve overall patient clinical outcomes. At present, our hospital has built a complete NCs monitoring system covering all clinical departments. The clinical departments collect the data every month and submit it to the nursing department. In general, NCs represent a key tool in nursing quality management and contribute to improvements in patient outcome. However, after literature review and clinical investigation, we found an obvious research gap. Up to now, there is no unified, evidence-based quality evaluation standard for high-flow nursing management in respiratory ward. Therefore, the core aim of our research is to develop a nursing quality indicator system for high-flow therapy based on evidence-based principles. The system is intended to support the assessment and enhancement of nursing quality. Part 2, Methods. Theoretical basis. Structure frame. Our whole research adopts the classic structure, process, outcome, triple quality evaluation model, SPO model. Theoretical guidance was based on nursing specification for adult high-flow nasal cannula oxygen therapy from Chinese Research Hospital Association. Technical route. We designed a 3-stage closed-loop research workflow. Stage 1. Formulate research question using PICOs. Literature retrieval and evidence integration. Semi-structured interview. Then build the initial indicator pool. Stage 3. 2 rounds of Delphi expert consultation. Finally, form the complete indicator system. Data collection tools and methods. We set unified Chinese and English search keywords: high flow, humidified, oxygen therapy, high-flow nasal cannula, respiratory nursing quality indicators, retrieval databases include PubMed, Embase, Web of Science, Cochrane, CNKI OneFound. Retrieval time limits, all studies published from January 2018 to March 2023. Finally, we screened out 6 guidelines, expert consensus, and high-quality clinical studies as our evidence base. Second, semi-structured interview. By using purposive sampling, 15 frontline nurses and 5 nursing managers were selected as interview participants. We formulated exclusive interview outline, recorded and transcribed all interview content completely, then adopt closing 7-step analysis to extract clinical core indicators. Delphi consultation. 11 experts from tertiary hospital in Shanghai were invited. This is the inclusion condition for expert. The questionnaire consists of 3 sections. Instruction of the questionnaire, main body, including all indicators and expert information. First round consultation assess the accuracy of the indicator. Dimensions, naming, connotations, and importance. Second round consultation, experts reviewed their initial response in comparison with the summarized feedback from the first round. Data analysis. The closing 7-step analysis method was used for semi-structured interview. As to Delphi expert consultation, we use SPARS 25 to evaluate expert authority, use Candida's coordination coefficient to assess the level of agreement among experts. The AHP was applied to construct the judgment matrix. The Excel software was used to calculate the weight of each indicator. The AHP, developed by Professor Thomas Setti at the University of Pittsburgh, is a decision-making method to evaluate the relative importance of different elements. Part 3. Results. Expert authority and coordination. 11 experts participated in the study. Expert authority. Coefficient of the 2 rounds promoted from 0.9 to 0.91, and Candida double value promoted from 0.357 to 0.605. After 2 rounds of expert consultation, we finally formed the high-flow nursing sensitive quality indicator system, including 3 first level indicators, 11 second level indicators, and 31 third level indicators. Part 4. Discussion. We analyze the necessity, scientificity, reliability, and limitation of our indicator system. Let me make a brief summary of our research. This study, guided by the SPO framework and the group standard, through literature analysis, semi-structured interviews, and the Delphi method, developed a nursing quality indicator system containing 3 first-level indicators, 11 second-level indicators, and 31 third-level indicators. As we know, the purpose of our research is not just only to form an indicator system, but to serve clinical applications. After completing this research, we construct specialized sensitivity indicators for respiratory medicine based on the index system. We have clearly defined the indicator names, calculation methods, and collection scale. From 2024 to 2026, the implementation rate of key nursing measures for high-flow oxygen therapy promoted from 77.76 to 85.83%. During the process of indicator monitoring, we continuously made quality improvement. For instance, based on the requirements of equipment management, we added backup oxygen tanks to deal with sudden gas supply interruption. We established inspection and usage procedure for oxygen tanks, and also conducted emergency response drills. That's all of my presentation. Thank you for your listening. Finally, wish the conference a complete success. Thank you.